Hi, my name is Asad Lak. I'm a research fellow at the Brigham and Women's Hospital, and the topic of my talk today is national practice patterns and outcomes of stereotactic body radiotherapy versus conventional external beam radiotherapy in the management of spinal metastases. I have no disclosures. Spinal metastases are seen in almost 30 to 60% of all cancer patients, and the management of these metastases involves a multidisciplinary care that is based on several patient and disease-specific characteristics. Traditionally, symptomatic, uncomplicated metastases have been managed with conventional external beam radiotherapy. However, as the patient's overall survival is improving, there is a need for more effective and durable radiation treatment options. This is where stereotactic radiosurgery comes into play. Advanced image guidance and improved targeting techniques allow for delivery of higher doses of radiation, and over the past decade, the utility of stereotactic body radiotherapy is increasing. Our objective was to evaluate the national trends in utilization of different modalities of radiotherapy for the management of spinal metastases. We also aimed to evaluate if stereotactic radiotherapy improves time to systemic therapy and survival outcomes. In order to answer these questions, we used the National Cancer Database, which is a comprehensive database comprising more than 70% of all newly diagnosed cancers in the United States. However, the NCDB has some limitations because it only includes data about initial presentation and first-line therapies. Also, it only has overall survival for survival outcomes analyses. We queried the NCDB for all newly diagnosed stage 4 cancer patients who required spinal radiotherapy within 3 months of diagnosis from 2004 to 2016. The patients were stratified by radiotherapy modality into either stereotactic radiotherapy or conventional external beam. Within the stereotactic radiotherapy, we subgrouped the patients based on the fractionation schedule into either single fraction SRS or hypofractionated SRS. The patient's demographic, clinical pathological, and hospital characteristics were assessed for associations with utilization of stereotactic radiotherapy versus conventional external beam using a multivariate logistic regression model. We also analyzed the overall survival outcomes using multivariate Cox proportional hazards model. Overall, we found almost 35,000 patients with spinal metastases who received radiotherapy. The most common tumor types were lung adenocarcinoma, small cell lung cancer, and prostate carcinoma. This plot demonstrates the trend in utilization of radiotherapy modalities. From 2004 to 2016, the utilization of conventional external beam decreased, while hypofractionated SRS and single fraction SRS increased. On multivariate logistic regression model, we identified that the receipt of stereotactic radiotherapy was more likely in academic setting, elderly patients, those with higher comorbidity index, recent years, and also varied by geographical location and primary tumor histology. Gender, insurance status, and race were found to be not associated with stereotactic radiotherapy versus conventional external beam. Our preliminary overall survival results indicated that single fraction SRS, after adjusting for patient characteristics, care setting, tumor type, and systemic treatment, was independently associated with an improved overall survival compared to conventional external beam and hypofractionated stereotactic radiosurgery. Other variables that were found to be associated with an improved overall survival included private insurance, academic setting, surgical resection, and systemic therapy. So in summary, despite the limitations of registry data, by using rigorous variable design and analyses, we were able to look at national practice patterns for spinal radiotherapy with an unprecedented scope. The use of spinal radiotherapy for spinal metastasis has been increasing for the last decade, regardless of modality. However, significant gaps remain to implement these advancements in the community setting. Surprisingly, and in line with the SABR-COMET-1 trial, our results indicate that SRS leads to better overall survival than conventional external beam. Lastly, our findings demonstrate that these patients can be better managed at academic tertiary care centers that have the technology and expertise to do stereotactic radiotherapy. In the end, I would like to thank my co-authors, Nayan, Dr. Smith, and Dr. Jörg Gillescu for their assistance and guidance. I'm happy to take any questions. You can reach me at my email address, and thank you so much.